Skip to content. Cookies on www.hse.gov.uk. We use some essential cookies to make this service work. We'd also like to use analytics cookies so we can understand how you use the service and make improvements. Accept analytics cookies, reject analytics cookie. View cookies. Menu. Search X. Search hse.gov.uk. Search hse.gov.uk. Times. Search. Industries. Construction. Health and social care services. Pesticides. Domestic gas. Public services. Agriculture. Entertainment. Waste management and recycling. Motor vehicle repair. Offshore oil and gas. Industries A to Z. Topics. Basics for your business. Ritter. Kosh. Display screen equipment, DSE. Asbestos. Work equipment and machinery. Stress and mental health. PAT testing, portable appliance testing. Work at height. Coma. Topics A to Z. About house. News. Sign up for free updates. Contact us. Information in other languages. Our mission and priorities. Careers. Products and services. Books and products. Training and events. Testing and monitoring. Research and consultancy. Help us to improve the website, give your feedback. Home. Topics. Stress and mental health at work. Management standards. Management standards. Open stress at work menu. Stress at work 1. Causes 2. Signs 3. Risk 4. Employees 5. Mental health. Stress at work. Mental health. Overview, mental health 6. Mental health for employees 7. Mental health for line managers 8. Management standards. Stress at work. Management standards. Overview, management standards 9. Before you start, prepare the organization 10. Step 1, identify the risk factors 11. Step 2, who can be harmed and how 12. Step 3, evaluate the risks 13. Step 4, record your findings 14. Step 5, monitor and review 15. What to do next 16. Do I have to follow the management standards approach? 17. Suicide prevention 18. Case studies 19. Reporting a concern 20. Resources 21. Before you start the management standards approach, prepare your organization. Before you start to implement the management standards approach, it is essential that you ensure that the resource, support, and infrastructure for the project are in place. To do this you should secure commitment 22, particularly senior managers' approval and support for tackling the issue and committing adequate resources, in particular, staff time. Secure commitment from employees and their representatives. Consider the need to establish, and membership of a steering group 23. Consider the project planning 24 and its continuing administration. Consider the timing and mechanism for communicating policies 25. If appropriate, develop an organizational stress policy, PDF, 26. Record what you have done. Secure commitment. Many employers have already recognized that they should tackle stress at work and may be taking some action, so you may already have some idea about what factors will secure commitment at the highest level in your organization. However, to maximize the impact of a business case, the following information may be useful. The legal case. The law requires employers to tackle work-related stress. The Management of Health and Safety at Work Regulations 1999 require employers to assess the risk of stress-related ill health arising from work activities, as with any other hazard. The Health and Safety at Work etc. Act 1974 requires an employer to take measures to control that risk. The business case. Tackling stress brings business benefits. When preparing a business case, there is a tendency to focus only on the direct cost of an employee being absent. Research has shown that work-related stress has an adverse effect for organizations in terms of maintaining business output and performance, staff performance and productivity, staff turnover and intention to leave, attendance levels, staff recruitment and retention, customer satisfaction, organizational image and reputation, potential litigation. Many of these issues will have associated costs, such as arranging suitable replacement bank staff in healthcare or supply teachers. Also, think about the impact work-related stress could have on the unit or team. For example, losing one colleague for an extended period with a stress-related illness can have a dramatic impact on the workload and morale of the rest of the team, particularly in smaller teams. The key message here is that, left unchecked, the cost associated with work-related stress and ill health to the business will continue to grow. Tackling this issue has the potential to stem these losses and improve the efficiency and effectiveness of the organization. Moral case: tackling stress prevents ill health. Prolonged periods of stress, including work-related stress, have an adverse effect on health, with strong links between stress and physical conditions, such as heart disease, back pain, headaches, gastrointestinal problems, and psychological effects, such as anxiety and depression. Stress can also lead to other behaviors that are harmful to health, such as drinking too much caffeine or alcohol, drug abuse, or smoking. Tackling the causes of stress before they lead to ill health can prevent harm. How can you secure commitment from employees and their representatives? The management standards approach encourages joint working between management and employees, either directly or via their representatives, to tackle the causes of work-related stress. Staff are only likely to take part if senior managers show commitment too. To successfully implement the approach, managers and employees should work together, both to identify the issues/stressors and develop solutions. Employees, who do the work and understand what causes any problems, are often best placed to suggest ways the task could be improved. Employers won't know until they ask them. To get employees involved, you should tell them why you are taking action and emphasize management commitment to making the workplace safer. Involve employees and their representatives, for example trade union and health and safety representatives, at the beginning of the process. In any groups you set up to take the work forward. In identifying the problems and the solutions. In monitoring any interventions. Inform employees about what you are doing to make changes. If you decide to prioritize your efforts to a limited area of your organization, tell people and explain why. Steering groups. Smaller organizations may not need a formal steering group, where they can gather information in simpler ways. But larger organizations will benefit from having a representative group to steer and drive the project. This may be a pre-existing working group, for example a health and safety committee. This will allow the workload to be shared. Allows you to include more people's view. Means the project won't rely on a single person. There is no one right way to organize a steering group, as management structures and cultures will vary between and within different sectors of employment. For some organizations, it may be helpful to have subgroups of the main steering group that reflect their specific organizational structure. For example, an organization may have departments or branches that have semi-autonomous management structures. In these cases, using subgroups to steer the process may help. Representatives from these subgroups should attend the main steering group to feedback and share information. Who should be part of a steering group? Typical members of a steering group are senior managers, employee or their representatives, trade union representatives, health and safety managers, human resources representatives, occupational health representatives, line managers. What are the key activities of a steering group? The main function is to oversee and facilitate the implementation of the management standards approach, acting as a project management group or board. Key activities include project naming, project management, planning, Securing and managing resources. Marketing. Managing communications. Monitoring progress. Approving action plans. Generating and approving management reports. Top tips from users. Have people with the capacity to carry out the actions from steering group meetings. Have someone on the group with project management experience, if possible. Involve unions. The steering group is key. It should have individuals who are keen to make a contribution and make the project work. You should have a team who can be mutually supportive. If a structured steering group is used to drive the project, resources can be kept to a reasonable level. Key roles within the steering group. There are 2 key roles you should try to include in a steering group. The project champion should be a director in the area that has responsibility for sickness absence and/or health and safety. Acts as the representative of the project at the board and updates it on progress. Actively promotes the project and its remit. Ensures the project is adequately resourced. The day-to-day champion takes the role of project manager. Organizes and facilitates meetings. Documents decisions, to provide an audit trail. Keeps the project on schedule and on budget. Is typically a health and safety manager, HR professional or, in some cases, an occupational health professional. Plan the project. Don't overlook planning. You should check what you already have in place. Don't reinvent the wheel or start from scratch. There will be existing policies, procedures, and initiatives that can be used to achieve some of the steps. Implementation of the approach will not happen in a vacuum, and there may be other activities to consider when preparing a plan. For example, if there are changes planned for the near future, how will these impact your plans and, if possible, factor these in. Top tips from users. Start small and grow. For large organizations, it may be useful to pilot the approach in a section of the organization so they can learn from experience before rolling it out globally. Don't use ongoing change as an excuse. Change is almost a constant in some sectors. This should not be used as an excuse for not taking action. Get the timing right. Ensure that key activities such as surveys and focus groups are not scheduled for peak holiday or busy periods where employees may not be able to participate. Planning experience, if available, co-opt someone with project planning experience onto the steering group. Forward planning, stop and think about what is involved in each step of the process and plan ahead. You should break down the process into manageable chunks. Resources, the plan should be resourced. Failure to do so can cause unnecessary delays and loss of momentum. Most importantly, ensure interventions are adequately resourced. Be realistic, make sure the plan is achievable. Dates for completion and deliverables from the activities should be realistic. Communications and policies. The management standards approach requires the participation and input of different groups of employees. Effective communications play a vital part in engaging them, providing them with timely information and providing a channel for their views. To be effective, communication should go both ways, so you should listen to the views of employees and answer their concerns. Many users have developed a communication strategy to run throughout their implementation of the approach. This typically includes considering what will be communicated and the how and when of the communication activities. What to communicate. What is communicated will to depend on your organizational structure and the way you choose to implement each step of the approach, but is likely to include messages from the board, or equivalent, demonstrating its support for the project. Project objectives and terms of reference. A project plan. A timetable for employee involvement, surveys, focus groups, etc. Names of steering group members. How to volunteer to participate in activities, including the steering group. A nominated contact person for the project. Results from staff surveys. Action plans. Progress updates. How to communicate. You should consider if workers can access the communication channels you choose. Consider both how easy the channel is to access and, more importantly, its effectiveness. Use multiple channels and ensure the message is rich in content. Be innovative and get people involved in developing communications. You could have a competition to design a slogan or poster for the project, for example. Communication channels to consider include briefings via existing networks, team meetings, etc. An intranet bulletin board. Email, check who has access and consider how to reach others. Adding the topic to the agenda of regular meetings and asking for feedback. Notice boards/posters. Existing staff newsletters. Leaflets. Individual memos or letters. Using trade union communication routes to show their support too. When to communicate. Consider appropriate timing as part of your communication strategy. Whatever schedule you decide, stick to it. Leaving an information vacuum can seriously undermine a project, as the vacuum may be quickly filled with rumors and misinformation that may be hard to counter. Avoid times where the organization is particularly busy, for example with seasonal pressures or holiday periods when fewer staff will be around. Don't forget those who are not in work, on maternity leave or off sick, or who work away from a base frequently. A rumor handler was appointed who was trusted by staff and could be contacted to check the validity of the current rumor. NHS Trust. Step 1. Identify the risk factors. 27 takes you through the first step in the management standards approach. Back to top. Related content. How to tackle work-related stress, a guide for employers on making the management standards work, PDF, 28. Is my risk assessment approach suitable and sufficient? Equivalence checklist, PDF, 29. Link URLs in this page. Stress at work www.house.government.uk/stress/index.htm. Cause www.house.government.uk/stress/causes.htm. Signed www.house.government.uk/stress/signs.htm. Risk www.house.government.uk/stress/risk-assessment.htm. Employee www.house.government.uk/stress/help-employee.htm. Overview, mental health www.house.government.uk/stress/mental-health.htm. Mental health for employees www.house.government.uk/stress/mental-health-employees.htm. Mental health for line managers www.house.government.uk/stress/mental-health-line-managers.htm. Overview, management standards www.house.government.uk/stress/standards/index.htm. Before you start, prepare the organization www.house.government.uk/stress/standards/before.htm. Step 1. Identify the risk factors www.house.government.uk/stress/standards/step 1/index.htm. Step 2. Who can be harmed and how www.house.government.uk/stress/standards/step 2/index.htm. Step 3. Evaluate the risk www.house.government.uk/stress/standards/step 3/index.htm. Step 4. Record your findings www.house.government.uk/stress/standards/step 4/index.htm. Step 5. Monitor and review www.house.government.uk/stress/standards/step 5/index.htm. What to do next www.house.government.uk/stress/standards/what next.htm. Do I have to follow the management standards approach? https://www.house.government.uk/stress/standards/doi.htm. Suicide prevention www.house.government.uk/stress/suicide.htm. Case study www.house.government.uk/stress/case studies/index.htm. Reporting a concern www.house.government.uk/stress/reporting concern.htm. Resource www.house.government.uk/stress/resources.htm. Secure commitment www.house.government.uk/stress/standards/securing.htm. Steering group www.house.government.uk/stress/standards/steering.htm. Planning www.house.government.uk/stress/standards/planning the project.htm. Communicating policy www.house.government.uk/stress/standards/communications.htm. Organizational stress policies www.house.government.uk/stress/assets/docs/example policy.pdf. Step 1. Identify the risk factors www.house.government.uk/stress/standards/ Step 1/index.htm. How to tackle work-related stress, a guide for employers on making the management standards work www.house.government.uk/pub/ind430.pdf. Is my risk assessment approach suitable and sufficient? Equivalence checklist www.house.government.uk/stress/assets/docs/checklist.pdf. Is this page useful? Yes, no. Report a problem with this page. Footer links. Industries. Construction. Health and social care services. Pesticides. Domestic gas. Public services. Agriculture. Entertainment. Waste management and recycling. Motor vehicle repair. Offshore oil and gas. Industries A to Z. Topics. Basics for your business. Ritter. Kosh. Display screen equipment, DSE. Asbestos. Work equipment and machinery. Stress and mental health. PAT testing, portable appliance testing. Work at height. Coma. Topics A to Z. About house. News. Sign up for free updates. Contact us. Information in other languages. Our mission and priorities. Careers. Products and services. Books and products. Training and events. Testing and monitoring. Research and consultancy. Search. Copyright. Cookies. Privacy. Accessibility. Disclosure of information. Vulnerability disclosure. All content is available under the Open Government License v3.0, except where otherwise stated. Updated May 11, 2021.